Have you ever wondered that thousands of men are going about their daily lives, completely unaware that a serious threat is growing inside them? They're playing with their grandchildren, working in their gardens, planning their next vacation, all while an invisible enemy silently gains strength. That enemy is prostate cancer, and it doesn't care about your plans or retirement. It doesn't care about the fishing trips you've been looking forward to or the graduation ceremonies you want to attend. It works in silence, giving you no warning signs until it's ready to turn your world upside down. But here's the shocking truth that your doctor might not have told you. By the time most men notice something's wrong, precious time has already been lost. Time that could have made the difference between a simple treatment and a life-altering battle. Today, I'm going to share critical information that could save your life. Information that many men discover too late. Because while you might feel healthy right now, the clock is ticking. And unlike other health issues that announce themselves with pain or discomfort, this silent killer prefers to work in the shadows. The choice is yours. Will you be one of the men who waits until it's too late? Or will you arm yourself with the knowledge that could mean the difference between life and death? Did you know that 1 in 8 men will be diagnosed with prostate cancer in their lifetime? That's a staggering number, and it's a reality we can't ignore. Just this year alone, over 288,000 new cases are expected in the U.S., with nearly 34,700 men losing their battle to this disease. However, when caught early, prostate cancer has a survival rate of 98%. That's why recognizing subtle warning signs is crucial. Don't brush off changes in your body. Pay attention. If you're still here watching this video and find these insights helpful, comment 1. And if you don't like the topic, comment 2 below to let me know about your opinion, so that I may bring more useful information for you. In this video, we'll uncover 8 early signs of prostate cancer you should never ignore. Your health is worth it. Let's take a moment to understand prostate cancer and why it's so important to pay attention to your health. The prostate is a small, walnut-shaped gland that plays a big role in male reproductive health. It's responsible for producing the fluid that nourishes and protects sperm, a vital part of the reproductive process. When we talk about prostate cancer, the most common type is adenocarcinoma, which starts in the gland cells of prostate. Here's the tricky part. Not all prostate cancers are the same. Some grow so slowly that they might remain symptomless for years. These are the ones that often go unnoticed, creating a false sense of security. But then, there are aggressive forms that spread rapidly, posing serious risks to your health. These can quickly affect other parts of the body, leading to life-threatening complications. That's why knowing the signs and acting early is so crucial. Here are the first 4 warning signs. 1. Frequent urination and nocturia. Have you noticed that you're heading to the bathroom more often, especially at night? Maybe it's interrupting your sleep and leaving you feeling drained during the day. Frequent urination or nocturia. Waking up multiple times to urinate can be one of the earliest red flags. Why does this happen? The prostate gland sits just below the bladder and surrounds the urethra, the tube that carries urine out of the body. If the prostate becomes enlarged, it can press on the urethra, making it harder for urine to pass. This leads to increased frequency and urgency, even when your bladder isn't full. It's worth noting that aging and conditions like an overactive bladder or benign prostatic hyperplasia, BPH, can also cause these symptoms. But here's the key. If you notice persistent or worsening changes, don't dismiss them as just getting older. This is your body's way of signaling that something might not be right. 2. Painful ejaculation. Now let's talk about another potential warning sign that often gets overlooked. Painful ejaculation. For many men, this can be an uncomfortable and even embarrassing topic, but it's one that shouldn't be ignored. If you experience discomfort or pain during ejaculation, it can feel localized in different areas, your penis, testes, rectum, or even your lower abdomen. While occasional mild discomfort isn't always a cause for concern, persistent or worsening pain could signal an underlying issue with your prostate. Why does this happen? The prostate gland plays a key role in producing seminal fluid, which mixes with sperm during ejaculation. When the prostate is inflamed or undergoing changes, such as those caused by cancer, it can disrupt this process and lead to pain or discomfort. Painful ejaculation can also result from conditions like prostatitis, inflammation of the prostate, or BPH. But when paired with other warning signs, like urinary problems or frequent nighttime urination, it could point to something more serious, including prostate cancer. 3. Blood in urine or semen. Seeing blood in your urine or semen can be alarming, and for good reason. It's a signal that something isn't quite right. This condition, known as hematuria or hematospermia, can appear as visible streaks of blood or sometimes only be detected under a microscope. Either way, it's important to take it seriously. What causes this? In the case of prostate cancer, the presence of blood often results from vascular damage or tumor growth within or near the prostate gland. As the tumor develops, it can disrupt surrounding blood vessels, leading to bleeding that mixes with urine or seminal fluid. However, cancer isn't the only possible cause. Blood in your urine or semen can also result from infections, prostatitis, or a urinary tract injury. That said, these conditions should never be self-diagnosed or ignored. 4. Pain while sitting. Experiencing pain or discomfort while sitting may seem like a minor annoyance, but it could be an important warning sign of prostate cancer. This discomfort can range from mild, nagging aches to sharper, more intense pains concentrated in the pelvic region. Why does this happen? The prostate is located just below the bladder and in front of the rectum, so when it becomes enlarged or affected by a tumor, it can create pressure points in this area. In more advanced stages of prostate cancer, the disease may spread to surrounding tissues, intensifying the pain and making simple activities like sitting down feel unbearable. This pain might also radiate to the lower back, hips, or thighs, further complicating its origin, while other conditions, such as prostatitis or BPH, can also cause pelvic pain. Persistent or worsening discomfort should never be ignored. 5. Pain in back, hips, or chest. Persistent pain in your back, hips, or chest can be a red flag that something serious is happening in your body. While aches and pains in these areas are often attributed to aging or overexertion, they can also indicate a more concerning issue, prostate cancer, that has metastasized to the bones. When prostate cancer reaches an advanced stage, it can spread beyond the prostate gland, often targeting the bones. This can lead to persistent, deep-seated pain in the lower back, hips, or even the chest area. Unlike typical muscle or joint pain, this discomfort doesn't improve with rest and may worsen over time. The presence of bone pain is a significant marker of advanced stage cancer, and it requires immediate medical attention. It's also a key indicator that the cancer has moved beyond the prostate, potentially affecting other parts of the body. 6. Swelling in legs or feet. Swelling in your legs or feet might not seem directly related to your prostate, but it can be a subtle sign of something serious. This kind of swelling, often referred to as edema, occurs when fluid builds up in the lower limbs. When prostate cancer spreads, it can invade nearby lymph nodes. These nodes are a crucial part of your body's lymphatic system, which helps drain excess fluid. When they're blocked or damaged by cancer cells, the fluid has nowhere to go, leading to noticeable swelling. While other conditions, such as heart disease, kidney problems, or prolonged inactivity, can also cause swelling, lymphatic obstruction due to cancer is a serious concern that requires immediate attention. 7. Unintentional weight loss. Sudden, unintentional weight loss can be alarming, especially if you haven't made any significant changes to your diet or activity levels. While some may dismiss it as a welcome surprise, it's crucial to understand that unexpected weight loss can be a sign of something more serious, like prostate cancer. What causes this? When cancer cells spread, they can disrupt your body's normal metabolic processes. These cells demand a lot of energy, essentially stealing nutrients from your body to fuel their growth. This metabolic imbalance can lead to rapid and unexplained weight loss, often accompanied by persistent fatigue. Unlike intentional weight loss from diet and exercise, this kind of weight loss happens without effort and can leave you feeling drained. Even if you're eating normally, it's your body's way of signaling that something is off. This symptom is particularly concerning when paired with other potential warning signs of prostate cancer, such as pelvic pain, changes in urination, or blood in your urine or semen. Sudden weight loss is a red flag that warrants immediate medical attention. It's easy to overlook or rationalize these changes, especially in the hustle of everyday life. But your health is too important to ignore. If you're experiencing unexplained weight loss along with other symptoms, consult your doctor as soon as possible. 8. Numbness and weakness in limbs. Numbness or weakness in your limbs is a serious symptom that should never be ignored. While these sensations can have various causes, they could indicate advanced prostate cancer that has spread to the spine and is compressing the spinal cord. When prostate cancer metastasizes, it often targets the bones, including the vertebrae. This can lead to spinal cord compression, which disrupts the nerves responsible for movement and sensation in your arms and legs. You may notice a tingling sensation, loss of strength, or even complete numbness in the affected limbs. This condition doesn't stop at the limbs. If left untreated, spinal cord compression can also lead to problems with motor function, making simple tasks like walking or lifting objects difficult. Additionally, it may cause loss of bladder or bowel control, a sign that the situation has become more severe and requires immediate medical intervention. These neurological symptoms are a clear indication that cancer has progressed to an advanced stage, and swift action is crucial. Ignoring these signs could lead to permanent nerve damage or paralysis, making early diagnosis and treatment vital for preserving your quality of life. Risk factors for prostate cancer. Understanding the risk factors for prostate cancer can help you stay vigilant and proactive about your health. Age. Prostate cancer is strongly tied to age. Your risk increases significantly after the age of 50, and most cases are diagnosed in men over 65. Regular screenings become even more important as you get older. Family history and genetics. If prostate cancer runs in your family, your risk is higher. Having a father, brother, or close relative with prostate, or even breast cancer, can double your chances. Genetic predispositions, such as BRCA mutations, may also play a role. Race and ethnicity. Studies show that African American men face a higher incidence of prostate cancer and are more likely to develop aggressive forms of disease. The reasons are complex, involving genetic, environmental, and healthcare disparities. Obesity and lifestyle. Obesity is linked to more aggressive and recurrent prostate cancers. Additionally, diets high in red meat and processed foods, combined with lack of physical activity, may contribute to increased risk. Incorporating a balanced diet rich in fruits, vegetables, and whole grains, along with regular exercise, can help reduce your risk. While you can't control factors like age or family history, you can take steps to manage lifestyle risks. Knowledge is power. Stay informed and proactive with regular checkups and healthy habits. Early awareness can save lives. Prevention strategies. Taking steps to reduce your risk of prostate cancer is one of the most empowering things you can do for your health. While no prevention strategy is foolproof, adopting certain habits can significantly lower your risk and improve overall well-being. Healthy diet. What you eat plays a vital role in your health. Focus on a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. Foods high in antioxidants, like tomatoes, rich in lycopene, and cruciferous vegetables like broccoli, can be particularly beneficial. At the same time, limit processed foods, red meats, and sugary snacks to reduce inflammation and overall cancer risk. Regular exercise. Staying physically active isn't just good for your heart. It's great for your prostate health too. Aim for at least 30 minutes of moderate exercise 3 times a week. Activities like walking, cycling, or strength training can improve your immune system and help regulate hormones linked to cancer risk. Maintain a healthy weight. Obesity is a known risk factor for aggressive prostate cancer. Maintaining a healthy weight through diet and exercise can significantly reduce this risk. Get regular screenings. If prostate cancer runs in your family, have an open conversation with your doctor, share your family history, and discuss whether screenings like the PSA, prostate-specific antigen, test are right for you. Regular checkups and discussions with your healthcare provider are key to catching any issues early. Prevention is about proactive choices. Start today for a healthier tomorrow. Recognizing the early warning signs of prostate cancer can truly save lives. Symptoms like frequent urination, pain, swelling, or unexplained weight loss should never be ignored. The earlier you catch prostate cancer, the better your chances for successful treatment and recovery. Your health is your most valuable asset, so don't hesitate to seek medical advice if you notice any unusual changes. A simple conversation with your doctor could make all the difference. So now that you understand the critical importance of prostate health, what's one action you're going to take today? Maybe it's scheduling that checkup you've been putting off, having that important conversation with your doctor, or sharing this information with someone you care about. Whatever it is, comment below and let me know. Because knowledge without action is like having a life jacket, but never putting it on. Remember, every day you wait is a gamble with your health. But you don't have to face this alone. Our community here is full of men who've taken control of their health, and their stories in the comments below might just give you the push you need to take that first step. If this information hit home for you today, don't keep it to yourself. Hit that like button and share this video with the men in your life who need to hear it. Subscribe for more potentially life-saving information that too many men learn too late. Because there's so much life left to live, and we want you here, healthy and strong, to live it. Your family needs you. Your friends need you. And your future self will thank you for taking action today.